Hi, I'm Dr. Richard Busch of the Busch Chiropractic Pain Center, and today we're going to discuss 5 things to consider before having back or neck surgery for a herniated or degenerative disc. And I think the first one, and probably the most important, is do I really need back surgery? I've seen statistics that suggest that less than 1% of surgeries for disc-related problems in the back or neck are actually necessary or required because they're emergency types of situations. What that means is that it becomes a situation where you can make a decision whether you really actually need to have that surgery or not. So before you have the surgery, start to consider the consequences that you may actually have to deal with later on. And those are that in many cases surgeries don't work. Okay, we deal with patients who have had both back and neck surgeries in the past. In fact, about 50% of the people I see have had either one or more failed back or neck surgeries in the past. Now, there are a number of reasons for the surgeries to not survive or not succeed. And it's not because the surgeons did anything wrong. It's because biomechanically speaking, when we're changing the dynamics of the way that your spine works, it actually puts more stress on the levels above and below that surgical procedure, or where that surgical procedure was performed, and it actually causes a great deal more stress and strain on those disc levels, and it accelerates degeneration there. So the interesting thing about this, and going back to it, is surgery necessary? And in many cases it's really not. What are the complicating factors of a back or neck surgery? One of the biggest complications that I think we've all probably heard about at this point is an infection called MRSA. In fact, I have a patient who's had an additional 14 surgeries after his initial surgery because he became infected with MRSA following a disc-related surgery on his back. You know, we can have other complications like nerve damage, or even other complications that may include continual or residual types of pain as a result of that surgical procedure. So when it comes to surgery, it's a pretty big deal. And once you've had surgery, you can't have it undone. So what I'd really encourage you to do is think about all the possibilities or all the things that could be involved once you have surgery. And really, again, if you can always have it done later, we should try every single thing we can do prior to that surgery to make sure that you can avoid it. What's the recovery time for a back surgery? Most of the surgical procedures you're looking at anywhere between 6 weeks and 6 months. In some of the more complicated spinal fusion types of surgeries, that can even be all the way up to a year. So those are things that we need to take into consideration. And again, along with that, if we've got something that we know has got about a 20 to 30% 5-year success rate, that's going to cause another complicating factor as well, because first of all, you've got back pain now, and you're going to continue to have back or neck pain following the surgical procedure. Even if you don't shortly after the surgery, it's something within 3 to 5 years that you will actually be experiencing again. So those are things that we need to take into consideration as well. What are the back surgery success rates? The success rate for spinal fusions is right about 20 to 30% over 5 years. What that means is 70 to 80% of the people who have a surgery are either going to have another one, or they're going to be in as much pain as they were prior to within 3 to 5 years. Now that's not as a result of anything that the surgeon did wrong. It's as a result of this increased stress that's placed at the adjacent levels to the spinal fusion. So the levels above and below begin to take on a lot more stress, and they start to wear out more quickly. As a result of just the regular discectomies, we do see scar tissue as a result of that, and also along with that, that portion of the disc becomes a lot weaker than the rest of the disc, and it becomes more prone to re-injury. So these are all things that we need to consider when we're looking at surgery. Are there other options? There are other options as far as surgery are concerned. You know, obviously we've got the normal types of options like epidural injections, cortisone, physical therapy, chiropractic care. In fact, most of the patients that we see have had almost all of these, or they've had them all, and they may have seen a couple of other chiropractors for treatment, but just nothing really responded for care. And that's the reason that we developed the DRS protocol. DRS stands for decompression, reduction, and stabilization, and that's what we're doing to help patients avoid those surgeries. So we're decompressing a nerve, taking pressure off of it, reducing a disc bulge, and stabilizing the whole thing to do it. The interesting thing, about 50% of the patients that I see have had at least one failed back surgery. So what that means is half the people I see have had at least one, and of that 50%, a lot of them have had more than one. I think the best option for everyone is to make sure that you're following some type of a conservative, non-surgical treatment and making sure that you're doing every single thing that you can to avoid that surgery, because once the surgery is done, you can't have it undone. If you have any questions or would like to schedule an appointment, please call 260-471-4090 or toll-free 888-471-4090 or visit our website at buschchiropractic.com.